Well, hello and welcome to another Thursday Live. And I am Dr. Jerry Dreessen, the Executive Director here at the AOPP. And we are still experiencing a little bit of choppiness, which is really weird. It didn't really happen until I hit live. So somehow between my recording studio and Facebook, there's a little bit of choppiness going on. So let's just get underway. And we've got a really nice action-packed adventure for you today. Last week, we talked about the human side of PEMF for those of you that are kind of searching, wondering what's going on. And this week, our part two of part three is PEMF for animals. So comfort, recovery, and barn-friendly best practices. Through the year, we've done a little bit of these as well, but as we're winding down, and again, those of you that are just learning about us and discovering us from some sort of a friend or feed, you'll get the most current information, but you're always welcome to go back in time and look at our previous broadcasts, or even doing a search. You can find us on our channel on YouTube. You can also search us on Facebook and LinkedIn. So if you are looking for that, you can find us there. So let's get started, shall we? Let's talk about on the animal side. I wonder if I make this a little smaller, if that helps out. We'll see if that changes that might help. Okay. So research and regulatory overview for PEMF for animals. And what we know is that with horses on the equine side, studies show temporary reductions in the lameness and inflammation in osteoarthritis cases. Effects are time limited and protocol dependent. If you do a deep dive, you can search and find a practitioner who helped a horse with a broken hoof using PEMF and the protocol that they went through. There's some really great stuff that's out there, but unfortunately, we can't jump in and say this does it because it wasn't peer-reviewed, double-blind, placebo-controlled study. So yet. But there's definitely enough information that's out there. Dogs and small animals, multi-week trials report improvements in gait and pain scores. Results vary, but trended toward PEMF as a helpful adjunct, but not a cure. Those of you that are using PEMF on small animals, you know that on the dog side, it helps put the puppy back into the dog. I've seen that happen in our area with the work dogs, the shepherding dogs, where as they get older, they love to be out there. You can see it in their eyes. They want to get out there and do stuff, but they can't because of their body. But again, using PEMF on their bodies, they're back up and running around, and they're enjoying life again as they were, designed to be. So those are some great, I guess, miracles, if you've seen it happen. Livestock. Early research suggests possible benefits for udder health and mastitis with cows, with no negative milk production impact, and larger studies are underway. Those of you that are in the dairy industry, you know that it can be a hassle if you have to tag and block udders, bypassing them on the milking machine, but to have PEMF placed on the area and having that clear up right away so that that udder can start producing milk again. Really good results with that too. And then, of course, with regulations, some states classify PEMF as veterinary medicine, but it's not medicine. But Montana, Nebraska, Oklahoma, and so they limit non-vet use, and there has to be either a vet present or the vet has to be the one doing the application. But again, we are out there. We are leading the advocacy and education on practitioner rights. And this so parallels other things that have happened in the world. If you can take a PEMF device, place it on your dog or your cat or your cow or your animal, and you have the knowledge that goes behind what needs to be done, that's totally different than having to take your animal to a vet to have certain things done, like a shot or a medication or a diagnostic X-ray or MRI or something like that. That's the line in the sand that is drawn. It's like, well, if people can do this on their animals, why can't they do it on other people's animals if they've been certified and have the training? So you don't need a veterinary degree to use PEMF. You don't need a doctor's degree to use a PEMF when it comes to humans. Same thing with animals. So we are out there. We are talking to people. We are setting up meetings. That is what your membership dues help us pay for, is to get out to those people, to fly out there, meet face to face, and have these meetings. So thank you for those of you that are current members, and those of you that are wondering, why should I join? That's probably the main reason if you are using this in a business with animals. So where PEMF fits in animal wellness on the common situations and providers. So again, with horses, the pre and post event routines, heavy training blocks, comfort and support for osteoarthritis or tendon issues alongside veterinary care. The other thing that PEMF does, those of you that are using it know that it helps bring in better blood flow. So any medications that the animal might be on, same thing with humans, is that it brings that medication in there even better. So it helps almost like a spot treat, driving in that medication to help that medication work even better. As far as small animals, dogs, again, recovery for active pets and working dogs, stiffness relief for aging dogs, occasional use for cats with vet oversight where needed. Excuse me. Let me take a sip here. So again, with livestock, early stage use, we talked about mastitis and general wellness in dairy. Shows animals alongside vet-directed care. Practitioners, body workers, barn PEMF pros, rehab facilities, collaborating with vets and trainers. And then, of course, our support, where we get in there and help with regulatory updates, scope guidelines, and advocacy for non-vet wellness roles. What a typical animal PEMF session looks like, with safety-focused areas and dosing. Safety and handling. So, read body language. Those of you that work with animals, you know how to do that. You can see it in their eyes. You can tell when dogs smile and when they frown. I'm sure, with horses and stuff too. And then allow movement, adjust the coil placement, ensure safe environments, whether there's cross ties or mats or pens. And again, work with the trainers and the owners. Sometimes they have a different setup. Oftentimes, if there's a barn involved, you are always in a certain area where you set up, and then the animals, livestock, they get used to that too. Sometimes you're out on the field, and those of you that follow Jessie, you know that she has a battery unit, mobile unit. She goes out into the field and does PEMF care too. So that's available out there as well. And then, of course, when we get into dosing, and I'm going to make this a little bit bigger for you. There we go. Safety and handling, we talked about that. And then dosing, as far as start conservatively, increase over multiple sessions, adjust based on behavior, trainer feedback, or veterinarian input. And again, here's where you need to stick to your guns, because sometimes they went, that was great. Can you turn it up more? If that's outside your protocol, don't do that. If somebody says crank it up, and they know nothing about PEMF, stick to your treatment protocols. And then, of course, we're here to support you for best practice training, session note templates, and, of course, shared professional experience. We've got a large group in our Facebook group and in our private Facebook group. You can always drop your questions in there as well. And then practical tips for animal owners and how to use PEMF safely and effectively. So coordinate with your vet if you need to for diagnosed conditions. If they are noticing things, and again, I have yet to see a vet that isn't pro PEMF, especially if it's going to help the animal out. And they're like, yes, do what you can, try. Yes, definitely try it. Get back to me on it. And I've never seen anybody say, oh no, you can't do that because I need to be the one to do that. Those of you that work with vets, that they're more than happy to have you be the one doing PEMF because it would just add to their time. They would have to be there for that. So it's interesting how it's more on the regulatory side with non-vets. Oftentimes there's lay people that are in there and they, want to, of course, do no harm, but that's why we're educating them. So they'll be more than happy to allow that to happen. And then, of course, start during calm periods between events and herds, stressors to understand individual responses. So, where is that animal in their family of animals? What are their stressors? What's the weather like? Is it too hot, too cold? And then with horses, of course, the warm-up quality, post-haul recovery, willingness to work, if they've got that limp. It's interesting. I had some people on their talks that they do. Oftentimes, the rider and the horse have the same problem. And that's because the horse, if they're like kicking up on a certain spot during their walk, that the rider has to address their spine differently for that. So you'll often see a rider and a horse complement each other on their problems, which you can also trace out and begin to do sessions on too. And then tracking the real world changes. So when you are doing this, we're talking about with horses, if those are things that you track, yes, no, 0 to 10, with those different elements. Dogs, again, how do they handle stairs and play? Stiffness, no mobility throughout the day. Are they good for 30 minutes and then they just curl up by the heater for the rest of the day? And again, livestock, what's their appetite like? Their, the milk quality and output, and then their comfort in the pens. So that those are the things that you look at. And then our support, of course, owner-friendly educational tools, communication training, and wellness aligned forms and waivers. So we've got the tools for you to take, and then you can, brand them with your stuff. You can take what we have and totally, redesign a flyer or a handout. But you've got that as a starting block for what you want to do. And then on our practical tips for new practitioners, again, building safe, professional, wellness aligned skills. So learn the body language. We talked a little bit about that. With horses, the ears, the tail, the tension, licking versus chewing. Dogs, yawning, lip licking, soft eyes, loose body. Livestock, the ear, the head carriage, their vocalizations, their cud chewing behavior. And then start short and light. We always talk about low and slow. Those are the things that you need to do. And then increase only with clear comfort acceptance. If you've got a horse that walks right up to you and they're ready to go, that your program is perfect for them. And then stay inside the scope. So focus on comfort, recovery, and wellness. Avoid disease terminology or implying that PEMF replaces vet care. That'll get you canceled in a short period of time. If you say, oh, you don't need to do that, PEMF will do that for you. You got to stay inside your lanes, right? That's the main thing. So just be careful. And you may be one-on-one on the same page with the owner, but who's within earshot and may hear it incorrectly. So again, those are conversations you need to be careful of, because if somebody misinterprets what you say, then it could start a whole cascade effect down the line. So again, our support, client communication and training, our FAQs, of course, consent documents, and then state-specific guidance. So again, if you are able to grab those things and send them to us, that would be great too. It would be better for those of you that are in your state to find it than for us to go out to 50 different places and look for that. It's a great time saver for us, so that would help us out too. And then guidance for experienced practitioners. Again, refinement, documentation, red flag awareness, and the pre-event, the quick prep, post-event decompression, next day recheck. Dogs, 4 to 6 weeks, osteoarthritis again. Dogs with their hips, that the breeding, as they get older, those are the things that go out. So, if you can get a protocol going, even like when a dog ages to a certain point, then that's when their hips start to go bad. Well, if you can be there to, it's like, okay, now that your dog is getting close to whatever that age is, let's start working on their hips. Or even before that, if you can do a 6 months to a year prior to what the average hip is on a dog, as far as when it starts to age out, you can add length of time by eliminating that inflammation going on in their hips. And then communicate. Cows again. Those of you that are out on the dairy, you know how well this works. And then with communication, and that's always the best thing. And anytime we've ever had an issue between a PEMF user and some sort of a board, was miscommunication or lack of communication or lack of education. So we want to be able to provide all of those things. So the other thing is red flags. So if there's new or worsening, lameness, acute heat or swelling or fever or systemic illness or neuroscience, just stop immediately and refer to a vet. 9 times out of 10, sometimes 10 times out of 10, it wasn't the PEMF. But if an owner sees a problem and sees that you were the last person to walk away using PEMF, they're only going to assume that that's what caused it because it's new to them. So just do due diligence and get another set of eyes on the animal that you're working on. So we have some advanced certification topics, vet communication toolkits, and collective practitioner advocacy and data, plus our PEMF con that we do. So those of you that went to that, you have access to the speakers and they get into depth on some of these issues as well. So short and sweet this week. Thanks for hanging on, and sorry for the bumpiness again of the lagging video. And we'll see if we can get a good handshake going between our communication systems and internet. So if you are interested in more about what we're talking about, you can become a member. It's very easy to do, very inexpensive. We don't ask for much, and again, we do a ton with what you give us. So you can go to PEMFprofessionals.com. If you have any questions or tips, again, info@PEMFprofessionals.com. We are on our website. We're in the back behind the curtain where the wizard, or where the mayor lives to conduct the wizard. We're doing some retooling. So if you find it on our website to getting some redirects or something not displaying properly, just hang tight. We're getting that fixed for you too. But you can always reach out to us. You can give us a call and talk with Lauren as well. So with that, I want to thank you again. And with what we've got here, we've been talking about PEMF for animals, comfort recovery, barn-friendly best practices. And if you go through the certification course, you get all of that. We're just barely touching the surface on that. And if you like what you saw today, please share with your friends. Get this information out to those that are using PEMF. They may have no idea how to use it, or they just got a machine from a friend, or there's people that are selling their old machines online, and they just give it to you or sell it to you without any instructions. So if you find yourself with a machine going, hey, this is great, but how do I use it? We're the people to give you that data. So reach out, share, Facebook, Instagram, LinkedIn, YouTube, and of course our blog. And those of you that are members that are looking at our research tab, again, That's one of the things that went clunky on us. So you're only getting like 2 or 3 researcher articles where you should have full access to that. So we hear you. We're working and trying to get that alleviated as well. So, and with that, thank you so much for your time. And I look forward to seeing you next week where we wrap up our whole year for our final broadcast for 2025. So take care and we'll see you then. Bye.